The Chairman, Presidential Task Force, my colleagues on the task force, media representatives here present, ladies and gentlemen. Our record as such today shows a total of 61,440 confirmed cases from 578,841 persons tested for COVID-19, while 56,611 cases have been discharged. We have sadly lost 1,125 persons to the pandemic. We now have 3,704 active cases as more persons are treated and discharged, with a case fatality rate of 1.8%. While most of those infected are between the ages of 21 and 40, the fatalities are higher among older groups, especially those above 60 years with comorbidities. We are therefore advised to take responsibility and protect the older ones among us. I think I will pause at this point to just join my voice with the appeal made by the chairman of the Presidential Task Force in terms of government being willing and ready to dialogue with the youth of this country in respect of the ongoing protests. You recall that we have said this over and over, that between 21 and 40, ages of 21 and 40 are the most affected in COVID-19. NSAS should not just be seen as a problem of the police force. It's a metaphor for the ills of our society, which all of us collectively have to challenge and put behind us. But it requires all hands to be on the deck to correct and find solutions to the problems confronting us as a nation. It's an appeal, and we will continue to talk to our youth. They are brothers, they are sisters, they are friends, and every one of us has a stake in our country to make it a better place for all of us all. The COVID-19 pandemic has underscored the need for infrastructural development of our health system, and we are determined to address them. We have distributed medical equipment such as ventilators and oxygen concentrators to all the federal tertiary hospitals and the states. One of the challenges we have in our hospitals is irregular and unstable power supply. And this often leads to frequent breakdown of power-sensitive medical equipment, resulting in the disruption of services. We are exploring opportunities that will guarantee regular and stable power supply in our hospitals. And to this end, we received the management of the Niger Delta Power Holdings to discuss a partnership that will ensure regular power supply to our teaching hospitals and federal medical centers. This partnership will not only ensure steady power supply, but reduce the overhead cost of the hospitals. The savings we make from this initiative will be plowed into other areas of need in the hospitals. Our experience with managing the pandemic shows that many of those who died could have been saved if they had access to services on time. During our intervention in Kano, ambulances were deployed to evacuate cases, especially those in critical conditions, to hospitals for treatment. The National Emergency Medical Services and Ambulance System, NEMSAS, is designed to provide Nigerians with prompt access to medical treatment when needed. Last week, we met with the Corps Marshal of the Federal Road Safety Corps to discuss a collaboration for the deployment of some of the critical assets of the Corps, such as ambulances, emergency medical treatment personnel, and communication infrastructure for the emergency medical treatment program. The collaboration will also ensure that accident victims have access to emergency medical care in health facilities without having to wait for payment or deposit. I shall again remind all citizens of the risk of being in large gatherings. To reduce the risk of spread of COVID-19, members of the public are advised to adhere to the following measures. Wear a face mask or covering when out in the public. Wash your hands frequently with soap under running water for at least 20 seconds, or use an alcohol-based sanitizer if water is not readily available. Maintain a physical distance of at least 2 meters from others in public spaces. Cover your mouth and nose properly with a tissue paper when sneezing and or coughing. Dispose of the tissue properly immediately after use. You may also cough into your bent elbow if a tissue paper is not available, or handkerchief. Avoid close contact with anyone showing symptoms of respiratory illness. And stay at home if you feel unwell until you recover. And do not mingle with others or congregate. And finally, avoid large gatherings of more than 50 persons and gatherings where physical distancing measures are not put in place. I thank you for listening.
Chairman, sir, honorable ministers, gentlemen of the press and ladies, good evening. Well, I'm going to talk more on the safe reopening of the NYSC camp. Last week, the DG talked about the ensuring the safe reopening of schools. Now our youths are about to go back to camp, so we need to make sure that everything is in place for them and they are safe. And if there is any event, we'll be able to pick it first. So we are going to focus on the support we're providing the NYSC to ensure the safe resumption of the camp corps members across the country as they make plans to resume the activities. And this, I believe, is coming up on the 10th of November. Of course, we all know that COVID has caused a lot of disruption in most of our activities, and no one anticipated that this will happen. We've all made plans. Young ones have planned that they will go to camp. But unfortunately, it didn't happen because COVID-19 came and disrupted most things. So we have been working with the Ministry of Youth and Sports through the NYSC to put in place and strengthen the infection prevention and control capacity of the NYSC camps. Beyond this, we are going to support the NYSC with authorities to ensure prompt identification of COVID cases for treatment. One of the key measures we have put in place is the use of rapid diagnostic tests for screening corps members as they come to camp. These RDTs are actually approved for use in specific settings by the WHO and will be beneficial for the prompt identification of COVID cases for treatment, given their high sensitivity and specificity. We have also a self-reporting form that NYSC, the corps members, will fill before they go to camp. The form will enable them to give their details ahead of their resumption, and this will give us a seamless process for sample collection. So every corps member must fill this form before resuming. It's online. To make the process easier, we're going to provide step-by-step guide on how to go about this, as well as the guideline to stay safe while in camp. Of all of this, we are doing in collaboration with the NYSC officials. Each NYSC camp will also have what is known as the IPC Vanguard. They will help to monitor compliance with the COVID-19 preventive measures to significantly lower the risk of infection. We'll also be using NYSC communication channels, including the NYSC radio stations, to amplify these efforts in each state, as well as to sensitize the public and the NYSC community on what is being done. Last week, we actually carried out the risk assessment for the camp in Abuja, and that helped us to look at the gaps, look at the guidelines that we had set up. And so that has helped us to find the risk assessment tool, and this will be rolled out across the country this week. This tool will be used by state NYSC and surveillance team to evaluate the potential risk and them. So we have been working with the NYSC to ensure the safety of our youth and community as they resume activities across the country in various camps. We ask for cooperation of all corps members and adherence to IPC measures for their safety and that of their loved ones. To ensure the safe reopening of camps, it is important that we work together collectively. Of course, the government cannot do it alone. It's a collective measure, it's the collective action. We all have to take collective responsibility. So I wish all our corps members the best. Thank you.
Chairman of the Presidential Task Force, ministers, members of the PTF, gentlemen of the press, good evening. So today I'll be talking about some of the milestones achieved in the fight against COVID-19 since we started this activity back in March. Tomorrow will be 31 weeks since the PTF was inaugurated, and I think it's important for us to know that we have put in a significant amount of work, and we do have quite measurable output. Some months back, the DG NCDC set an ambitious target for testing, where we said we'll be expecting states to test up to 1% of their population. In 7 months, 2 states have now reached that target, the FCT and Lagos State. 3 states are halfway towards achieving the target of testing 1% of their population. These are Rivers, Plateau, and Gombe. And we will continue to urge these states and the others that are still far behind to please work towards catching up. The NCDC continues to ramp up testing capacity in all 36 states, while at the same time we try to continue to relax restrictions so that we can fully reopen our economy. Now, some of the noteworthy achievements that the PTF has had while coordinating what is clearly a huge exercise. We deal with at least 50 federal government MDAs and numerous partners in a collaborative response, which is multi-sectoral, which is harmonized, and which aims to remove duplication, as well as smoothen the process of implementing COVID-related responses in the country. Through our various member MDAs, we have trained at least 17,000 healthcare workers in infection prevention and control, in laboratory operations, and case management. In this vein, we must thank the healthcare workers for their dedication and partnership. Working with the Federal Ministry of Health, the PTF has added over 77,000 beds in more than 130 treatment centers and more than 250 intensive care unit beds through the support of our donors and private sector partners. With the NCDC, we've worked tirelessly to approve at least 69 certified public laboratories across Nigeria to ensure that free testing is available to those who need it the most. Currently, there is at least one molecular laboratory in every state in the country. In 6 months, we have also attracted significant funding from the private sector to fight the COVID-19 pandemic. As you're aware, we have, through COVID, they've commissioned temporary as well as semi-permanent isolation and treatment centers in every state in the country. With the federal government, the PTF has led the provision of funding to the states. Every state in the country has had at least ₦1 billion towards the COVID-19 pandemic as a grant from the federal government. We've also worked with a humanitarian to provide food and cash transfers together with the UN single basket, as well as placed a moratorium on government enterprise and empowerment program loans to help businesses recover. With our risk communication group, we have mobilized thousands of volunteers for risk communication and community engagement activities throughout the country, and we have a presence now in every single local government in the country. In line with our good governance and accountability mandate, all expenditures and allocations of funds from the federal government have been publicly available on our transparency dashboard and resource trackers on the PTF website, which is at statehouse.gov.ng/COVID-19. We have also provided additional information on donor contributions to the national response. There's no doubt that we have made strides. As a country, we should be proud of the response we have run for COVID-19. Not only have we started relaxing restrictions on international travel, we have reopened schools, but we are also starting to see the gradual recovery of businesses and the Nigerian economy as a whole. For this, we thank our partners. They are too numerous to mention, but we have, in terms of technical support, we cannot but mention COVID, the UN single basket, and their partners, including the EU, the US government, Bill and Melinda Gates Foundation, as well as the Clinton Health Access Initiative. We must also thank the state governors for their support, their ongoing cooperation and initiative, as well as other partners for supporting the PTF to fulfill its duty to the Nigerian people. To conclude, I'd like to briefly mention the issue of the 181 students and staff of a private boarding school in the Lekki area of Lagos that have tested positive for COVID-19. This brings to the fore the risk associated with relaxing some of our restrictions, which we are very much aware of and continue to monitor closely. I would like to encourage state governments, just like the Lagos state government, to continue to take appropriate steps in monitoring and ensuring that incidents of this kind are managed well in line with national guidelines for treatment. There's no doubt we must continue to remain vigilant as more schools reopen across the country. So in light of the achievements, we cannot get complacent. We are far from reaching the promised land. COVID-19 is still very much around with us. We know that we have lost more than 1,000 Nigerians to the virus, and we continue to mourn every one of them. With the case fatality rate in Nigeria standing at just below 2%, we know that we must continue to do more to prevent further losses. For this reason, I urge you all to please continue to follow safety measures at all times diligently. Thank you.
Thank you, National. Arrived for us to take questions. I hope we are ready. So let's take the very first question.
Good evening. My name is Gloria Mezuke from Channels Television. My question is to the National Coordinator. Are you concerned about a possible spike in the number of COVID-19 cases as a result of the End SARS protest? Thank you.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Udi. I report for Arise News. And my two questions are actually directed at the National Coordinator, Dr. Sani Aliyu. Yes, with the reopening of the NYSC camps, yes, you have spoken about the fact that they will get tested, but social distancing, that will still be a challenge. How do you intend to achieve this in the camp, if that is even possible? And also, staying with you, with the new protocol as we enter the new phase, we expected some update, especially as it concerns airports, aside from the Abuja and Lagos, especially the international ones in Kano and Port Harcourt. We want to know if there's any update with regards to when they will be allowed to resume international operations. Thank you.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the coordinator. Sir, I would like to know if the country is well kitted to sustain free testing and treatment of COVID-19. If no, what other alternative are we looking at? My next question is for the DG representative. Why do we have rapid test kit flooded in the Nigerian market at the moment and already being used by some Nigerians, despite the evidence revealed by the medical lab scientists on poor performance of these rapid test kits? I would like to also know if the supply for rapid test kit by WHO is among those rapid test kits that were validated by the medical lab scientists. Thank you very much.
Thank you very much for those questions. It seems today we're going to stay with the National Coordinator mainly and the representative of the DG and CDC. And at the end, we'll have closing remarks from the Chairman. So may we invite the National Coordinator, Dr. Aliyu.
Thank you. So yes, we are concerned about the impact of what has been going on our incidence of new COVID infections in the country. We are monitoring the situation in terms of testing closely, and we continue to urge all, young, old, the vulnerable, to please be careful. Any mass gathering of any sort is an event amplifying situation for COVID-19. And COVID is still very much around with us. We don't want to get infected and carry the infection to our loved ones, especially those at home that might be vulnerable. In terms of social distancing, quite right, Amaka. Social distancing will be a challenge, but the way we hope to implement the NYSC camps is we will apply what we call a sort of, they will be in platoons, so it's called platooning or bubble effect, where a set of a team would remain within themselves. They will not be interacting with other teams in the camp. So if we have an infection within that single platoon, we don't need to close the whole orientation camp. We will just isolate those that they are in contact with. And the same will apply to living quarters, etc. And we've also reduced the average number of corpus that are in orientation camps. That's why it's going to be staggered. So, and even when it comes to living quarters, for instance, there will be that, we'll ensure that there is distancing when it comes to the living quarters, as well as keeping the windows open, etc. So it's not just physical distancing alone, it's actually all the other measures that will come into place, such as hand washing, such as the use of face masks, and in addition to that, the testing as well that will happen. With the testing, we're looking at having a two-step process. We will use the rapid antigen test as well as the PCR test on every NYSC member attending. The rapid antigen test result will be available within 15 minutes. So as you come into camp, you will be tested. If you are positive based on the rapid antigen, straight away you'll be excluded. If you are negative, we will wait for the PCR test, which we know is a lot more sensitive and will take 2-3 days to come back. And then if you are positive, you will be excluded from camp and you will be taken into isolation and managed appropriately. So those multiple steps will definitely reduce the risk of transmission of COVID within the camp itself. Update on airports, yes. So we have been working very hard to see how we can open up the remaining 3 airports. We've already got an arrangement with COVID to help with some of the infrastructure as it relates to internet services in these airports, because that's really critical for the functioning of the travel portal itself, as well as the supply of IT equipment for the port health staff. We are also engaging more surge staff in these airports, but one of the real critical issues we are facing now is the issue of laboratory capacity in the 3 locations. We've been able to get, at least for Kano, we have a private laboratory that's just engaged with Kano state government and will be able to provide testing for passengers coming through Kano. For Port Harcourt, there's one private lab that's currently in the process, but we will urge the Rivers State government to please engage closely with private laboratories to see if we can open up private laboratories in Port Harcourt, because really this is going to be the main critical block when it comes to quickly opening the airports. We need to be able to, with certainty, say that we have enough capacity in Kano, Port Harcourt, and Enugu for testing in order for us to open the airports fully. But we'll continue to engage with the Ministry of Aviation as well as the relevant state governments. But again, I will urge the state governments to please help us support this process. The more private labs opened, the easier it will be for us to push the cost of the test as well down. If you have just one lab, it's more difficult for the negotiation between the state governments and the private labs. Rachel, you talked about how do we sustain free testing of COVID-19. Well, there's no doubt once COVID is over, and this is just my view, I really don't think it's possible to sustain all 36 molecular laboratories in the country. It will not be sustainable for a lot of the state governments. But while we still have a pandemic going on, it should be possible, working both within our own budget as well as the donations that come from our partners, to make sure that there's enough in terms of test kits, supplies, etc. for COVID. And things are changing. I'm convinced that the 2 rapid tests that have been authorized by the WHO now, the rapid antigen tests, will turn out to be very useful in the clinical setting. So in fact, what will probably happen is the molecular testing will at some stage become a second step confirmatory testing, and most of the testing in the health facilities will switch over to rapid antigen testing. The exercise we'll be doing with the NYSC will confirm how well these rapid antigen tests work versus PCR, and will give us the confidence to roll them out massively across all the health facilities in the country, so that every accident and emergency has access real time to COVID-19 testing, and the results will be available within 15 minutes, so that they can isolate patients as they come in, and they will be able to manage them accordingly. Thank you.
Thank you. Rachel, you asked about the test kit. Now, I want to correct something. WHO did not supply the rapid test kit. They only approved the use in some emergency situation and in some specific areas, in some specific situations, and that's why we're using it for the NYSC. And so NCDC is working with the Medical Laboratory Scientists of Nigeria, Council of Nigeria, and NAFDAC to validate the test kit. And when that is ready, when the result is ready, actually we will announce it publicly, to be made public. So that's for that. And then in terms of the rapid test kits that are going on, being sold, that is very unfortunate, because the Medical Laboratory Scientists Council of Nigeria has been very transparent in all that they've been doing in the validation of the rapid test kit. They've made pronouncements regularly telling us the ones that are not, and I don't think they have approved of any so far. They have not approved of any. So if they are being sold in the country, then it's very unfortunate, because the only organization or the only organization that can approve is the Medical Laboratory Scientists Council and NAFDAC, and they have not done any of that such. Thank you.
Well, we're coming to the closing of today's PTF briefing. May I please request the chairman of PTF for his closing remarks?
I don't have any question. Gloria, truth be told, 2 weeks from today, if you get all the people that congregated at the Lekki Toll Plaza and ran a test, you would establish for sure several infections. Any mass gathering that does not adhere to the non-pharmaceutical initiatives or interventions that have been put in place, wearing of masks, social distancing, keeping personal hygiene, and avoiding mass gatherings, they become super spreader events, whether you like it or not. So I can say with a definitive voice that 2 weeks from today, get everybody that congregated in those places, not only at the Lekki Toll Plaza area, at the Unity Fountain here, and several areas where there have been mass gatherings in different parts of this country. We would definitely be contending with increase in infections. 2 weeks from now. And that's why we must be extremely careful when we congregate. And not to let, when you gather together in such an atmosphere where people do not bother about whether they have face mask on, you are creating a potential opportunity for carrier vehicles that will convey this virus back to wherever they are going to. So each and every person that has attended and has not put up any form of protection for themselves and others, and they return back to their families, if they've caught the virus, it means that there are potential carriers who are headed to a particular destination. And they will get back home innocently. Their families will receive them. And that becomes a sport for further transmission. We are at the stage of community transmission now. And all these mass gatherings would only reinforce that transmission in our communities. And this is what we must avoid. As a country, like Dr. Sani rightly said, we have done pretty well in spite of the limitation in our physical infrastructure, health-wise particularly. And that we have dampened the spread of the virus, and the curve has been flattened. But we must avoid a situation where we will have a resurgence again. Experiences in most countries, particularly in Europe, is quite indicative of the fact that countries that thought they have overcome the pandemic in Europe and in Southeast Asia are having to deal with the second wave. We're just about getting over the first wave of infections in this country, and we're doing very, very well. So my appeal to people who are congregating with total disregard for the non-pharmaceutical interventions, for the sake of our loved ones, should desist from it. Because anytime you turn up at those mass protests or mass rallies, even the political rallies that we had, I've spoken about it here severally, that there were potential super spreader events. And I believe that if those states where we've had all these activities will go back 2 weeks or conduct very rigorous tests of all attendees, in the next 2 weeks, you will see a potential spike in the numbers that are recorded in those communities. You can see even a slight increase in our country, a mild slight increase on a daily basis now. Look at the number of sectors that we've opened up. International travels, schools, we're talking about NYSC. We are asking all civil servants below level 12 to return to work. We have allowed for non-contact sports to commence, but now we are including contact sports because football is a contact sport, though without a stadium crowd. Looking at all these activities put together, we have virtually very few sectors of the economy and our social life that is not open up. Places of worship are resumed fully. Some maintain social distancing, some don't. I had a course to attend a wedding this weekend. when I looked at how people were mingling, I said, these people have not stopped romancing COVID-19 with its potential dangers. And honestly, we have to be extremely careful as a people that we've been lucky this far with a population of 200 million Nigerians. Our fatality rate that we have recorded is within the margin of 1,116 to date. We are extremely lucky as a nation that we do not have to aggravate any situation that could cause a second spike that will come, seeing what is happening in other countries, as if the second spike always comes with the deadliest part of the virus. And as much as possible, my appeal to Nigerians is that let's continue as we await the arrival of vaccines. Let's continue to just comply with the non-pharmaceutical interventions. The vaccine will come, but it's not likely to come in the nearest future. When it so shows up, the big boys will corner everything and will be scrambling through the World Health Organization to participate in the solidarity trials, and eventually they will push for equitable distribution. But initially, some countries have even paid for supplies far in advance before the vaccines even show up. So our best weapon, our best vaccine for now is adherence with the non-pharmaceutical interventions. Have a good evening. Thank you.
Thank you very much, Chairman PTF, and all members, including our participants, our viewers, and listeners at home. Well, we really need to drive home the message that we received today. And to bring this message to you, I would respectfully invite Dr. Nnamdi Maurice Berry to please give us the takeaway message. Dr. Berry.
Mr. Chairman, sir, the honorable ministers here, and other members of the PTF, gentlemen of the press, ladies and gentlemen, we've virtually come to the end of today's briefing with the closing remarks from the chairman. In our usual way, just give you a few words of advice for takeaway. First and foremost, all Nigerians should be reminded that COVID is still around, and that calls for serious caution. We cannot afford a resurgence. And what this means is that you have to continually tread with caution in all your activities. Avoid crowded places, avoid unguarded gatherings, and gatherings where the non-pharmaceutical initiatives are not recognized. So, to our youths, you've been advised to be conscious of the risk and the danger you are exposing to yourselves and to your loved families through unguarded gatherings and crowds. COVID is still around the corner, and we cannot afford a second wave of the pandemic. So on that note, I want to thank everybody for listening today, and continue to spread this goodwill message to our teeming youths to listen to the voice of wisdom and to be conscious of the kind of contacts they make on a daily basis. On that note, I want to thank everybody, particularly the chairman, for his concluding remarks that are very encouraging, and wish everybody a safe stay until we meet again on Thursday this week. God bless you, and God bless Nigeria.